This is Dr. Vaishali and I'm reading from the book Substance of Homeopathy, book written by Dr. Rajan Sankaran, chapter number 25 and case number 9, illustrative case number 9. Mrs. SR, 37-year-old, accompanied by her husband, come with the complaint of pricking pain in the right side of the throat. It begins immediately after she ate a uh, mango 4 months back. She has taken a lot of treatment, means took many antibiotics and has been to many ENT specialists without any relief. She also has a hypertension since the birth of her second child 5 years ago. Hobbies were housekeeping, cooking, reading, and magazine reading. Dreams are unpleasant as well as pleasant. The pleasant one is that I am flying high and want to come down but cannot. The pleasant one is that I got an offer to teach in a nearby school. She did very well in exam, is well qualified BAD, GCE, yet has been unable to get a good teaching job. Classmates who were much inferior had got job. She did get offer, but the timing was not suitable. She is very anxious about the exam. Has palpitation before speaking. I want to do everything in the best possible manner. Means want a perfection. She is more tense before her son's exams that he is. I feel guilty that I don't devote enough time to my home. She does not want other to think ill of her. Is very keen on producing a good impression. The house should be a spick and span. Analysis of this case. The main feature of this case is the lack of confidence. She has an anticipatory anxiety, timidity, appearing in public, and certain compulsion seen as concerns about the trifles. For example, the house should be a speak and span, etc. Her dreams represent the same feeling, flying high, want to come down but cannot. Indicate the lack of confidence and tension. The other dreams indicate success, where she has got a job. The chief complaint is a fixed complaint which came on after eating a mango. Fixed idea is there, and this is the psychosis. The remedy was given Cilicia with a great result. Case number 10. Mrs. SD came to the clinic without appointment with the complaint of the dark circle around the eyes. Diabetes mellitus, having a diabetes mellitus, taking a Deonil 111 and headache before menses. She is a lawyer and a housewife and very well dressed. Bright lipstick, marked sandal across the cheeks, greasy face, and dreams were owns a big house with a huge room by the sea. I walk on the beach. It is good house. It is by the beach. Then I ask why walk, and because I'm a diabetic, so I like to walk. And I asked fast or slow, and she said fast. Now I asked how is the house in the dream. The She said huge open space all around. Then I asked where you tense before exam. Were you tense before exam? And she said very much. Then I asked when else. She say going to new place, meeting new peoples and engagement, etc. Then I asked any other dream you remember, and she said temple, daughter, met with the accident, but the blood was white. Talking to my brother in the USA, and he informed me that everything is fine. This dream came when I was worried about him. So then I asked, are you religious? And she said, I believe in a God. I don't do anything like praying and all daily. And I asked, tell me about your childhood. She said, it was good and very happy. And then again I asked, what was your nature as a child? And she said, aggressive. If anyone cheated, I fought back, and I always wanted a fair fight. I fought with others for my brother. I was protecting everyone like that. I was good in study but quiet in the class. I used to play outside all the time. And I asked, what is the biggest tension? And she said, the children. Since they have arrived, they born. I used to be outgoing earlier. Now children come first. I am very tense. tense that they should do well. Everything has to be like clockwork. I want the children to be perfect. I don't want anything wrong with them. I'm very particular about clothes and dresses. I have trouble relaxing, and I kept telling myself I'm going to get diabetic. And I am very particular about things. I mean, really fastidious, and I let go for a day or two, and then I am back in control and sensitive to scolding. Inside, I get bothered, but don't show it to others. And what about your hobbies? And she said, reading, going out, traveling, and music. An analysis of this case is what? In this case, we see the tremendous lack of confidence and anxiety that things should be in order, perfect, faultless. She is fastidious, is sensitive to reprimand, and has a tremendous anticipatory anxiety. She is very particular about the clothing, her children, etc. There is a constant tension. She cannot relax, keeps stretching herself to the limit of her capacity. This is the cancer mechanism. The remedy is carcinosinum, as we have other symptoms like ameliorated seesaw open air, travel desire to, and sensitive to music. She is at the very center of the miasm. With the treatment, the saddle lessened her headache and went, and the diabetes improved remarkably. Now, case 11, Mr. PJ, 32-year-old, came in the March 1989 with a complaint of hypertension, sleeplessness, heavy head, and frequent urination. He also complained of forgetfulness with respect to name, lack of concentration while reading and listening. Easy exhaustion, would get tired from minimal exertion. Mentals were get very nervous before an interview, cannot bear anyone shouting at him, hands and feet become cold, and at times the hands trembles. As a child, he wanted peace everywhere, could not bear to see a fight. He gets suicidal thoughts, and when he cannot achieve something he feels he could. In the case record, he has written that he was married but did not have sex for the several months. When questioned, he gave several excuses of lack of privacy, fear of consumption, etc. But it seems that the real reason was a feeling of impotency. He did not mention it, and his wife mentioned me before. Analysis of this case is what? We find premature senility. In an old age complaint at a young age, there is a suicidal disposition when he fails in something. This indicates a syphilitic miasm. However, there is a fear of being scolded if he doesn't perform, intense nervousness before an exam or interview. He also need to cover up his impotency. He give many excuses to hide it. This indicates the psychotic miasm. The miasm is psychosyphilitic, or you can say cancer miasm. The remedy was given agnus castus, and which has the mental weakness, loss of concentration, etc. Associated with the sexual weakness, heaviness of the head, etc. Agnus castus falls in the cancer miasm as seen in the pathology, secondary gonorrhea, rheumatic nodes and sterility, ulcerated gums, ulcer in the mouth, etc.